ring which is separating the atrium muscles from the ventricular muscle. That is due to presence of a fibrous tissue ring which is separating the atrium muscles from the ventricular muscle, and that's why both the atrium is forming a separate syncytium, both the ventricle is forming another separate syncytium part, right? So this is about the syncytial property of myocardium. And the last point which I'm writing here is point number 6, that is there will be presence of branching in case of myocardium cell at a regular interval. So there will be presence of branching, right, at a regular interval. So after understanding all of this point, if you look at the diagram which is given in book, right? So this is the diagram I have taken from book. You can easily find out after understanding all of this point, if you look at the diagram which is given in book, right? So this is the diagram I have taken from book. You can easily find out that single nucleus is present within a single cell. So this is a single nucleus. Okay, so this is the nucleus. Now two cells are connected with one another, and there is a dark color line, dark color region. So this dark color region is nothing but your intercalated disc, and at the same area where this intercalated disc is present, the gap junction will also be present. And you can easily find out the regular branching pattern in case of myocardial cell. So they branch out with one another, which is completely different from skeletal muscle, because skeletal muscle is a single longitudinal fiber. So if I go back to this all point, okay, and now if I ask you, try to correlate all this point with skeletal muscle and see which one is different, which one is similar. So the first point, striated muscle, obviously the skeletal muscle is also a striated muscle, so this point is similar in both of them. Then single nucleus is present in myocardium cell. We know that multiple nucleus is present in skeletal muscle, so this is not similar. Intercalated disc, I told you already that this is an exclusive feature of myocardium, so this is also not present in skeletal muscle. Gap junction is also not present in skeletal muscle, and because gap junction are not present, they are not syncytial. Skeletal muscle is not syncytial, and branching is also not present in case of skeletal muscle. So within this 6 point, only the first point is similar between myocardium and skeletal muscle. All other are different from skeletal muscle, right? So this is important. So within this 6 point, only the first point is similar between myocardium and skeletal muscle. All other are different from skeletal muscle, right? So this is important for your MCQ point. Only the first point is similar between myocardium and skeletal muscle. All other are different from skeletal muscle, right? So this is important for your MCQ, although the points are simple, but try to remember all this point. Now we are coming here, the modified myocardium, right? So why it is known as modified? Okay, what kind of modification is happening in this conducting system of the heart tissues, right? So number 1 point, okay, there will be presence of very less number of actin and myosin. Actin and myosin's number or amount is very less in case of modified myocardium, obviously, because they are part of the conducting system. Okay, they are not going to generate contractile force, so that's why actin myosin's numbers or amount is less, and because of which striations are also fewer in case of modified myocardium, right? Striations normal myocardium. Second thing, very less number of cell organelles. Okay, very less number of cell organelles are present in case of modified myocardium, right? So cell organelles numbers are also very less. Like for example, mitochondria will be lesser, Golgi body they are lesser in modified myocardium. And number 3, very important, that there will be presence of a small round cell. So I'm writing here, presence of small round cell within the conducting system of the heart or within the modified myocardium. This cell is known as P cell. All of you know that this P stands for pacemaker. This stands for pacemaker cell. So what I'm saying, all part of the conducting system, they are made up of which kind of myocardium? Modified myocardium, right? And this modified myocardium contains a small round cell, and that cell is known as P cell. P stands for pacemaker cell, meaning pacemaker cell is present within each and every part of starting from SA node, AV node, bundle of phase, and Purkinje fiber. So, what do you mean by this pacemaker cell? We all know that pacemaker cell means they are capable of generating spontaneous impulses. So I'm writing here, they are capable of generating spontaneous impulses. They are capable of generating spontaneous impulses. So I'm writing here, they are capable of generating spontaneous impulses. Okay, spontaneous impulses without the help of, without the stimulation of sympathetic or parasympathetic system. Getting a point? So pacemaker cell meaning is that they can produce heartbeat spontaneously, automatically, even if you cut your sympathetic and parasympathetic system from the heart. This spontaneous heartbeat production or spontaneous impulse production capacity is known as automaticity of heart. This is known as automaticity property of the heart. Very, very important. So automaticity means this is automatically or spontaneously beat production capacity, and this is present in each and every part of the conducting system. So automaticity is a property of the SA node, AV node, bundle of his, as well as Purkinje fiber. Although, if you look at the automaticity power, how do you understand? If you look at the rate of automaticity, rate of automaticity, then this rate is different in different part of the conducting system. Getting my point? So because of the presence of pacemaker cell, all part of the conducting system, they have this automaticity property. But now if you look at the rate, then SA node has a automaticity rate which is very, very higher, that is 60 to 80 beat per minute, which can maximally go up to 100 beat per minute, right? Then AV node and bundle of his, they are also capable of producing heartbeat spontaneously, but their rate is 40 to 60 beat per minute, right? And the Purkinje fiber, okay, they are also capable of beat production, but the rate is 15 to 40 beat per minute. So now if you look at that automaticity rate, then I can understand that AC node is the most powerful, right? And the beat production capacity at the level of AC node is 60 to 80, which is highest among all part of the conducting system. Because of which you know that SA node is the dominant tissue which has inhibition or suppression on other part of the conducting system, like for example AV node, like for example bundle of phase, like for example Purkinje fiber. What I'm saying, just try to understand that SA node is like the head of the department. So when the head of the department is present, then what will happen? This AV node, this bundle of phase, the Purkinje fiber, they are the other faculties. Okay, they will remain inhibited. So SA node is the powerful. He is saying that AV node, bundle of phase, Purkinje fiber, all of you don't have to produce heartbeat. You just conduct my impulses, because SA node is the powerful, he is giving some instruction, and SA node is generating beat. The other part, AV node, bundle of his Purkinje fiber, although they are capable of producing beat, but in normal heart, they are not producing any heartbeat because they remain under the suppression of SA node. This kind of suppression is known as overdrive. This is known as overdrive suppression of AC node on other pacemaking cell like AB node, bundle of His and Purkinje fiber. So this AB node, bundle of His and Purkinje of AC node on other pacemaking cell like AB node, bundle of His and Purkinje fiber. So this AB node, bundle of His and Purkinje fiber, they normally remain suppressed because of the dominant AC node, but they are capable of generating spontaneous heartbeat, so they are also pacemaker, but this kind of pacemaker is known as latent pacemaker. So latent pacemaker means normally they are sleeping, but whenever requirement is there, they can reactivate their pacemaking capacity. Pacemaker means normally they are sleeping, but whenever requirement is there, they can reactivate their pacemaking capacity. So normally SA node is the dominant one and he is producing beat in our heart. That's why it is known as that SA node is the pacemaker of the heart. So if I ask you why the SA node is known as pacemaker of the heart, because he is the dominant, he can produce maximum heartbeat. So this SA node is pacemaker due to maximum heartbeat production at the level of SA node. All other pacemaker, they normally remain suppressed and they are known as a latent pacemaker. So I told you already that this rate which I have written here, these are the automaticity rate. Automaticity rate means even if you cut the sympathetic and parasympathetic system, this rate will continue. Means SA node will going to produce a beat with a particular rate, even if you disconnect sympathetic and parasympathetic system. With this concept, there is a famous MCQ that what is the resting heart rate in case of transplanted heart? Getting my point? So they're asking MCQ that a person who has a transplanted heart, what is the resting heart rate? So obvious thing is that if you look at here, that automaticity rate of SA node is 60 to 80, which can maximum go up to 100 beat per minute. So whenever you disconnect sympathetic and parasympathetic system during this transplantation, the resting heart rate will be near equal to maximum, and that is 95 beat per minute. So this information you have to remember that in case of transplanted person, the resting heart rate is equal to 95 per minute. Because we have disconnected the sympathetic and parasympathetic system. Now there is a more tip. The resting heart rate is equal to 95 per minute because we have disconnected the sympathetic and parasympathetic system. Now there is a more deeper question. That if a person with a transplanted heart is doing exercise, okay, so now this transplanted heart is doing exercise. After recovery, is doing exercise. What do you think? His heart rate will rise during exercise or not? Because we have disconnected your sympathetic and parasympathetic system. So, what you know that if a normal person is doing exercise, suppose I am doing exercise, what will happen? Immediately my heart rate will start rising. Even before the starting of exercise, the heart rate can rise up, and that is due to sympathetic stimulation and parasympathetic stimulation. But in this transplanted heart patient, okay, already the sympathetic and parasympathetic system of the heart is disconnected. So what your answer that during exercise the heart rate should rise or not? The general answer is it should not rise, but you have to think of that whenever this transplanted person is doing exercise, his sympathetic system in the body will be activated, and sympathetic system which is connected in the adrenal medulla, they will be activated and they are going to produce epinephrine and norepinephrine. Now this epinephrine and norepinephrine is going to act on the beta 1 receptor of the heart, and because of this there will be increase in heart rate. So you must be thinking beta 1 receptor. This epinephrine and norepinephrine is going to act on the beta 1 receptor of the heart, and because of this, there will be increase in heart rate. So you must be thinking beta 1 receptor. Why it is not disconnected? Remember, you have only disconnected the sympathetic and parasympathetic system of the heart, but the receptors are present on the cell membrane. It is still there. So this receptor can be stimulated if there is presence of circulating epinephrine and norepinephrine. And where from this circulating epinephrine and norepinephrine is coming? This is coming from adrenal medulla. So whenever a person with a transplanted heart is doing exercise, first this epinephrine and norepinephrine has to rise, and then the heart rate will rise gradually. That's why it is said that resting heart rate during exercise will be raised in case of transplanted heart also, but this rise of heart rate will be gradual and slow rise of heart rate, not like that of the normal person, where heart rate rises immediately and to a very high level. Getting your point? So this point you have to remember about transplanted heart, right? So now we were discussing that due to this overdrive suppression. So overdrive suppression is a property of the SA node. Because of this overdrive suppression, the latent pacemaker normally remains sleeping. They are sleeping in your heart, but whenever requirement is there, it can be activated. So suppose due to certain reason, the SA nodal conduction is not going to the other part of the heart. So what will happen? This AV node will be reactivated and it will start beating. Right? That is the meaning of latent pacemaker. So you try to think of a condition of complete heart block. So complete heart block. You try to think of this clinical scenario. Suppose the complete heart block is preventing any impulses going to the complete heart. That is the meaning of latent pacemaker. So you try to think of a condition of complete heart block. So complete heart block. You try to think of this clinical scenario. Suppose the complete heart block is preventing any impulses going to the level of the ventricle. So all of you know that if there is a complete heart block at the level of this AV node, what will happen? The ventricular muscle, they are not going to get any kind of impulses. But after certain point of time, this Purkinje fiber which are present within this ventricular muscle, they are going to be reactivated and they are going to produce beat. That's why this AV complete heart block is preventing any impulses going to the level of the ventricle. So all of you know that if there is a complete heart block at the level of this AV node, what will happen? The ventricular muscle, they are not going to get any kind of impulses. But after certain point of time, this Purkinje fiber which are present within this ventricular muscle, they are going to be reactivated and they are going to produce beat. That's why we discuss this topic like this, that whenever there is a complete heart block, there will be, okay, so whenever there is complete heart block, there will be asystole of ventricle. Why there will be asystole of ventricle? Because the impulses are not coming to the ventricular muscle. So ventricle will stand still. There is no contraction from ventricle. But after certain point of time, the Purkinje fiber will be reactivated. Why it is taking some time? Because normally Purkinje fiber remain under the inhibitory control from SA node. So whenever there is a complete point of time, the Purkinje fiber will be reactivated. Why it is taking some time? Because normally Purkinje fiber remain under the inhibitory control. Fiber will think for certain point that he will wait, that the impulse is coming, but whenever the impulse is not coming, then the Purkinje fiber will take some measure to reactivate the heart rate once again. So after a period of asystole, what will happen? The Purkinje fiber will start beating. The Purkinje fiber beats. Okay. Purkinje fibers start beating, right? So this Purkinje fiber beat, which are produced because of complete bits. Okay, Purkinje fibers start beating, right? So this Purkinje fiber beat, which are produced in case of complete heart block, this is known as idioventricular. This is known as idioventricular rhythm. NEET PG has asked question that what is the rate of this idioventricular rhythm? I can easily understand that whenever Purkinje fiber is beating, it will produce a beat of 15 to 40 beat per minute. So the rate of idioventricular rhythm is 15 to 40 beat per minute. Okay, but I told you that this rate will only start after a time gap. So first there will be an asystole and then there will be a time gap. The guide is saying that this time gap is generally 5 to 20 seconds. So it varies from person to person. But after the asystole, Purkinje fiber will start beating after 5 to 20 seconds. Now this 5 to 20 seconds is very crucial for certain organ like brain. Guyton is saying that if the brain is not getting blood for greater than 4 to 5 seconds, right? So during this period of asystole, if this time gap is greater than 4 to 5 seconds, then the brain is going to suffer from hypoxia, and that hypoxia period of asystole, if this time gap is not getting blood for greater than 4 to 5 seconds, right? So during this period of asystole, if this time gap is greater than 4 to 5 seconds, then the brain is going to suffer from hypoxia, and that hypoxia will leads to dizziness. Okay, that hypoxia will leads to dizziness. There may be fainting also. There may be fainting also, and the person may fall on the ground also. All this this dizziness, fainting, which is occurring due to this asystole of the ventricle, which is occurring due to this asystole of the ventricle, is under the heading of Stokes-Adams syndrome. So this is known as Stokes-Adams syndrome. Getting my point? So Stokes-Adams syndrome, this Stokes and Adams is the name of scientist. They told that due to asystole of the ventricle, okay, if the fainting, if the dizziness is occurring, then that is known as the Stokes-Adams syndrome. So what is the cause? Cause here is the complete heart block is the cause of the Stokes-Adams syndrome. Although Stokes-Adams syndrome can also occur in the ventricular fibrillation, means ventricle is not able to pump properly due to huge amount of heart rate, and that will also decrease the blood supply to the brain, that will lead to dizziness or fainting. So due to asystole of the ventricle and dizziness, fainting and a fall on the ground is occurring, that is part of the Stokes-Adams syndrome, right? So this is all about your normal properties of the heart muscles that we have discussed. Now we are going to next part, that is the conducting system of the heart. So conducting system of the heart is very easy. Okay, all of you know it. exact location of SA node as well. So this diagram is taken from a research article. So you can find out here the superior vena cava opening. Okay, superior vena cava, and this is the area where the superior vena cava is opening. And